Renal stones are very common in pregnancy. Recently, many patients come with the history of renal stones, or many times pregnancy uncovers the incidence of renal stones in pregnancy. What are the symptoms of renal stones? What can be done for the management of renal stones in pregnancy? Do we require painkillers for renal stone in pregnancy? What are the non-surgical management? What are the surgical management of renal stone in pregnancy? Do renal stones affect unborn baby or pregnancy, or do renal stone lead to any complication in pregnancy? We will discuss all these questions in details. Good morning, I am Dr. Rajat and you started watching our YouTube channel, The Fertility Gynecologist. Most common question is, do the patients come and directly tell us that they have renal stones? In an era of sonography nowadays, when sonography is very common and most of the patients do get ultrasound for something or other, most of the patients who come to us, they usually tell us that we have a renal stone and which has been diagnosed on ultrasound. But mostly the symptoms of renal stones are very typical. The most common symptom how a patient would of a renal stone or a kidney stone would present to us, the most common symptom of renal stone is pain. In medical language we call it as a renal colic. This is a typical pain. First of all, you have to understand how a renal stone is formed. Now basically what I tell to my patients, the stone are formed by the sedimentation of blood. Urine is formed from blood, that is ultrafiltration of blood leads to the formation of urine, and renal stones are mainly formed in the kidney. So if the crystals by which the renal stone is formed, whether it is a calcium phosphate, whether it is a struvite, whether it is a uric acid, or whether it is oxalate, if those crystals are formed or are present more in blood, then there are more chances that they may be sedimented in the urine, and as a result the stone formation would occur. So if for any reason there is a stone which has been trapped in the ureter at the upper segment, mid segment, lower segment, then it may lead to the colic. Now why that colic occurs, you have to understand the basic anatomy of a genitourinary system. Kidney forms urine. From kidney to urinary bladder there is a tube which is called as ureter. Both the ureters go into the urinary bladder, and from urinary bladder there is a urethra by which the urine comes out. So most of the stones which are formed in the kidney, they drop from up to down, and ureter, like I said, it is the maximum diameter of ureter is 10 millimeter, and it is not a fixed pipe like tube. It is a collapsible tube, and the urine from kidney to ureter goes by the peristaltic movement. So ureter is sometimes relaxing, sometimes contracting, sometimes relaxing. So if the urine is dropped from kidney, the urinary stone is dropped from kidney to the ureter, and at that point of time ureter is constricting, the stone may get impacted, and that may cause pain. The pain is colicky because the pain would come and go, and that is the process of ureter to expel the stone out. And that typical pain is from loin to groin. This area is called loin, that is just behind our ribs, and this area is called groin. So a typical writhing pain, patient cannot sit or sleep or stand at one place. That pain lasts for 20 to 60 minutes, and that pain is not relieved by anything. It can be only relieved by a analgesic or a antispasmodic or a combination of both. And believe me, if you have seen a patient of renal stone once in your life, you will never forget. Apart from the pain, the other symptoms are the stone during the formation what it may do, it may scratch the endothelium or the epithelium of kidney or ureter or urinary bladder, and as a result there would be blood in urine. Sometimes that urine can be more, sometimes it can be less, or sometimes it is only microscopic, which is not visible by naked eyes. Another symptom of a renal stone is urine infection. Because the stone causes the stasis of urine, there may be a physiological hydronephrosis, and that urine infection may lead to the burning urine, or if the urine infection leads to the infection, the inflammation that may lead to fever. So these are the main symptoms of renal stones. Now, why are renal stones common in pregnancy? First of all, you have to understand what are the common causes of renal stone. For people who eat more processed food, people who eat more salt in their diet, means more food which is from packets like chips, wafers, farsans, namkeens, the processed food in form of maida, excess sugary foods, excess colas, who have a more habit of drinking more tea and coffee, who live in tropic climates, who drink less liquid overall, those are the people who have an increased tendency to form the renal stones. Now, in pregnancy, especially in the first trimester, there is a craving for a sweety, salty, and spicy food. Also, overall, the females are relatively, especially those who are pregnant, they are relatively fussy. They do not drink more water. And we in India live in tropic climates where there is more dehydration. If you don't drink more water, if you perspirate more, then there are more chances of stasis of urine, and the stasis of urine may lead. It is a good, what to say? It is a good breeding ground for the formation of renal stones. In pregnancy, what happens is, apart from that, pregnancy has a more progesterone hormone. Progesterone hormone leads to the stasis of urine, and also the pressure of the pregnant uterus on the ureters, which just lie besides the uterus. It leads to the physiological hydronephrosis. All these conditions combined lead to the increase in chances of renal stone in pregnancy. If I talk about the incidence of renal stone is from 1 in 500 to 1 in about 2000 pregnancies. But recent lifestyle, nowadays we found it relatively common, 1 in 200 to 1 in 400 patients. We find them very, very common. What are the dangers of renal stone in pregnancy? As such, renal stone does not damage pregnancy. It does not lead to harm to the unborn baby directly. But any kind of inflammation, any kind of infection may lead to the onset of a preterm labor or delivery at half months or 5th month, 6th month, 7th month of pregnancy. Because of that preterm and low birth weight, the baby may get harmed. There would be complications of low birth weight. But as such, renal stone does not do any harm directly in pregnancy. Like I mentioned earlier in the video, there can be phosphate stones, there can be oxalate stones, there can be uric acid stones, there can be a combination of all the stones. Oxalate stones, the most common stones are calcium phosphate, about 70 to 80%, followed by oxalate stones in about 20 to 40% of cases, especially in pregnancy. I have discussed about the symptoms of renal stone, how to diagnose the renal stone. Long back, when the ultrasound was not so much in way, the people used to get diagnosis by X-rays or CT scans if the patient is not pregnant. But since X-rays and CT scan cannot be and should not be done in pregnancy, ultrasound sonography is the best modality of diagnosing of the stones. Not only does it diagnose the presence of stone, it also measures the size of stone. It measures the exact location of stone, whether it is in the renal calyx or in the upper ureter or mid ureter or lower ureter or bladder. Why the size of stone is very, very important to us? Because like I mentioned earlier, the ureteric diameter maximum is 10 millimeter or 1 centimeter. So any stone of less than 10 millimeter size can easily pass through the urine. Any stone which is less than 1 centimeter or 10 millimeter in size, most of them do not require surgical management. And the only treatment which we suggest is hydrotherapy, is more water and antispasmodic and a painkiller tablet SOS. So the size of stone is very, very important. Now for females who have got renal stone early in the pregnancy, before pregnancy, or those who want to conceive, most of them come to us with, sir, do I need to get surgery done before the planning pregnancy, or can I conceive with renal stones? The answer is, if the renal stone size is less than 10 millimeter in size, then you do not need to do anything, just need to drink more water and you can plan the pregnancy. You do not need to undergo a surgery for renal stone or you do not need stone to get removed before you plan to get pregnant, because as such, A, it might not affect the chances of pregnancy, and B, renal stone per se would not directly affect your pregnancy. Most of the times, because I mentioned, because pregnancy is a good breeding ground for the increase in the size of stones, for formation of renal stones, the size slightly gets more, but that is not a major cause of a worry. The renal stones, most of them are about 4 to 5 millimeter in size. Most of them usually pass in urine in about 4 to 6 weeks. So you do not need to worry about this. Most of the people want to know what is the home management of renal stone. A, what to do for increase in passage of renal stone so that your stone passes from kidney to ureter to bladder to outside in the urine, and how to manage an episode of renal stone. First of all, hydrotherapy. Hydro means water, therapy means treatment. Drink plenty of water. Drink plenty of water. For though, see, I use this analogy to all my patients. In our north side in UP, there is something called as Nali on both the sides of road. Nali means the collection of the drainage water. This Nali, in that thing, the water is static, and that is why there is the all those garbage which is sedimented down. We can compare the renal stone to that Nali. If the blood is stasis or the flow of blood is slow, then the sediments like oxalates, phosphates or urates which are present in the blood, they may sediment, and they may lead to the formation of concretions, and over a period of time they may become renal stone. So treatment is, if the water is or the blood is continuously moving, then the chances of sedimentation would decrease, the chances of renal stone formation would decrease, the chances of passage of stone at a smaller site would increase. The more size of the renal stone, the less chances that stone may pass through the urinary passage. So hydrotherapy, drink plenty of water, 3 to 3.5 liters of fluid. Not only water, you can drink buttermilk, you can drink coconut water, you can drink lemon water, you can drink soups. All those kind of things can be taken. And at home, the first medicine of choice is a painkiller. If you are pregnant, then take paracetamol 650 milligram. Some people take half tablet, some people take 1/4 tablet. Please take full dose of paracetamol 650 milligram. If the pain is not relieved by taking a paracetamol tablet, then take some antispasmodic. After 2 hours, dicyclomine kind of thing, a brand name is cyclopam. In 99% of the cases, taking of a paracetamol and oblique cyclopam relieves renal stone in majority of the cases, and that is for a temporary measure. If you still are not relieved of that pain, then visit a doctor. Painkiller like a combiflam, like a Voveran, like a diclofenac, like a ibuprofen should never not be taken in pregnancy. I am repeating again, painkiller like combiflam, ibuprofen, Voveran, diclofenac should never be taken in pregnancy. It may lead to the early closure of patent ductus arteriosus, that may lead to the difficulty in breathing in the newborn. So avoid painkiller at any cost. The diet, I'll come to it in the later part of the video, what diet should be taken. Is any exercise good for renal stone? See, any kind of exercise improves blood flow in the kidney. When any kind of a physical activity, it improves the venous return to the heart, it improves the cardiac output, it improves the renal blood flow, and if the renal blood flow, it improves, the amount of urine formation increases, and that leads to the increase in passage of renal stone, or that leads to the decrease in the formation of renal stone. But in pregnancy, we do not advise any kind of high impact exercise. We only want you to be active. Walking is the best form of exercise. Walking, swimming, jogging. Do it slowly, with does not lead to the high impact. So what should you do to prevent the renal stones? Like I said, do not take too much salt. We do not require 4 to 5 grams of salt per day. We only require 1 to 2 grams of table salt per day. Not excessive sugar, no cola drinks. Avoid diets which contain oxalates in diet, which avoid high calcium diet. Again, I am repeating, high calcium diet should be avoided. Avoid fizzy cola drinks and drink plenty of water. Again, vitamin C is a very good stone inhibitor. It prevents the formation of renal stones. So take at least 1 to 2 lemon per day in your diet, either in form of lemon water or squeeze lemon on whatever you eat. So what are the worst foods as far as renal stones are concerned? Oxalate foods which contain oxalate should be taken in moderation. All kinds of nuts and berries, they contain very good quantities of oxalates. Brinjals contain good amount of oxalates. All things which contain seeds like tomatoes, like guavas, like bhindis, they should be taken in moderation, or preferably should be avoided for patients who have got renal stone. Which food are best? Like I said, if you avoid these foods, you take plenty of fruits. And in fruit, any fruit can be taken, preferably kiwi, raspberry. All those citrus fruits are very good. Bananas are excellent for people with renal stone. A medium sized banana contains both vitamin B6 and magnesium. We should normally avoid diet excessive in protein. Those people who have got renal stone, especially animal protein in form of egg, animal protein in form of pork, chicken, fish, they should not, especially for the people who have got uric acid stones. Also, excess of urad dals should be avoided. You can eat in moderation, but nothing in excess. Curd is an excellent for people who have got renal stone. Not only will it provide probiotics, but it also contains good amount of calcium. I'll come to it why you should take calcium rich diet for the people who have got renal stones. Cucumber, potato, everything can be taken because cucumber has got good liquid, good hydration. Chicken should be avoided, brinjal should be avoided, peanuts in excessive quantity should be avoided. Apple is very good for people with renal stone. Tomato, I would not advise to eat much. Milk and dairy products in form of paneer and cheese. See, if you are taking a calcium rich diet, what it does is calcium goes to the intestine, it binds with the oxalate in the intestine and prevents the reabsorption or an absorption of oxalate, thereby preventing the formation of oxalate stones. So if your calcium is less than 250 gram per day calcium intake in total form of dairy, milk and paneer and all those kind of things, then it will actually help to the people who have got oxalate stones. Tea, like I mentioned before, tea leads to the dehydration and it should not be taken in excess. 1 to 2 cups are fine. Which drug is the drug of choice for an episode of renal stone in pregnancy? Like I mentioned, first tablet should be cyclopam or dicyclomine tablet. It is an antispasmodic. It will relieve the spasm of ureter and it will enhance the passage of stone from top to bottom, and the moment the stone is in the free space, it will improve the pain. If the pain does not get relief within 2 hours, 1.5 to 2 hours after taking antispasmodic like cyclopam, then you should take a tablet called as Dolo 650 or a paracetamol 650 milligram. In most of the cases, the pain would get relief. Please do not take any NSAID like combiflam, brufen, voveran, diclofenac in pregnancy. It should be avoided at any cost. If still you do not get relief, please visit a doctor. So the overall management of a renal stone in pregnancy, first is wait and watch, second is hydration. If you can take it orally, it is fine. If you cannot take it orally, go to a doctor, get the pint started. Some people also give Lasix. Lasix or a furosemide is a diuretic which increases the formation of urine, and in Lasix should be avoided at all cost in pregnancy, but some people give in patients who are not pregnant. If the conservative management does not succeed, then we have got two many things which are at our disposal. One is a surgery and one is a laser. Laser is from the laser beams, the stone is broken into pieces and then the stone can be recovered. Either the pieces of stone, they pass through the urine, or the pieces can be recovered through the surgery. But this is called as ESWL, extrinsic shock wave lithotripsy. It is not preferred in pregnancy at any cost. Laser lithotripsy is not preferred in pregnancy. So in pregnancy, maximum we can do surgery, but also that surgery we do not do in first 3 months of pregnancy, we do not do in last 3 months of pregnancy. The best time to do a surgery in pregnancy is 4th to 6th month. What type of surgery we do? We do a surgery called as PCNL, percutaneous nephrolithotomy. Percutaneous means we put a small incision at the level of kidney, we put a endoscope inside, and we open the space between kidney and ureter, that is nephrolithotomy, opening of where the space where the stone is there, put a small incision. Either we take that stone directly out through the skin incision, or we, if it is possible, break it into the pieces so that it goes through the urine. Most likely if we are doing surgery, it is better if we take the stone out. That surgery we put it as the last resort. We do it only for impacted stones which are not resolved by the medical management, and only for those stones which are more than 10 millimeter or 1 centimeter in diameter. Now I have discussed in this video the calcium phosphate stones or oxalate stones or uric acid stone. The thing is, how do you know beforehand that this is a calcium phosphate stone or a uric acid stone? There are two ways to diagnose. If you do a urine analysis, we find that whether urate crystals are present or phosphate crystals are present. That way we can know and we can correlate with the ultrasound. Second thing is, if somebody has passed stone in past or recently, please preserve that stone, take it to the laboratory and get it diagnosed what type of stone it is, so that according to that type of stone you can at least avoid things which are there in your diet. And once the renal stone has passed or that it has gone out of the body and ultrasound says that there is no more renal stone, then do not chill and enjoy. Do not think that I cannot have renal stone again in my body. Once you have renal stone, that there are chances that it may occur again and again. The only thing is you need to have plenty of hydration. You need to avoid things which increase the formation of renal stone, and you need to stay active, stay out of the sedentary lifestyle. You should be relatively mobile, 45 to 50 minutes of physical activity per day. Hope you like the video. Please share the video and please do subscribe to our channel. Thank you. Bye bye.